The following segment is presented by Bremo Pharmacy.
There are some staggering statistics related to diabetes. An estimated 26 million Americans suffer from diabetes, with an estimated 7 million more that have diabetes and don't even know it. Ann Anderson is here from Bremo Pharmacy to help us understand this disease and how Bremo Pharmacy can help. Okay, so tell us exactly, what is diabetes?
Basically, it's a chronic disease that's associated with abnormally high levels of blood glucose or high levels of sugar in your blood. There are two different kinds of diabetes. There's type 1 diabetes and there's type 2. Type 1 is an autoimmune disease where your body's basically attacking the pancreas and it can't make insulin. And insulin is what gets the sugar into the body so it can be used. And type 2 is where the body is producing insulin, but it's not being used effectively, or there's not enough insulin that's being produced for the body to be able to use it.
So type 1 is something that really can't be controlled, but type 2, typically that's adult onset, would you call that?
Typically adult onset. Unfortunately, in this day and age, we're seeing more kids who are sedentary, they're not getting exercise, they're not eating like they should, there's more obesity younger. So unfortunately, there's more type 2 diabetes being seen in the younger population.
Those are not good statistics.
Mm-hmm. Yeah.
What are some of the symptoms associated with patients who have diabetes?
Patients will experience excessive thirst. They'll be going to the bathroom frequently and urinating. They may feel fatigued, have blurred vision, just generally not feel very good, kind of like they've got a virus.
Okay, so if you're experiencing some of those symptoms, getting screened would be a really great thing. Is screening for diabetes the only way to diagnose diabetes?
Screening associated with those symptoms, but the blood glucose number that shows up on the meter, excuse me, does indicate whether a patient is diabetic or not.
Okay, and at Bremo Pharmacy this month, there are free diabetes screenings at all the locations.
Yes.
Through the entire month of April?
Yes.
Okay, that's good. So tell us a little bit about that screening and how it works.
Well, a pharmacist will sit down with a patient and look at their risk factors for diabetes. Do you exercise? Are you overweight? That type thing. And also do test their blood sugar and see what their blood sugar is. If they're fasting, their blood glucose should be below 126. If they're not fasting and it's over 200, could be diabetes going on there.
All right, so knowing your numbers is key. The pharmacists at Bremo Pharmacy are great resources for the entire family. In fact, at Henrico Doctor's location for Bremo Pharmacies, there's a new program, Bellies, Babies, and Beyond, which really helps new parents navigate all those questions that they have during pregnancy, during birth, and following. So if you want more information about Bellies, Babies, and Beyond, or the diabetes screenings, please go to BremoRx.com.